Healthcare is one of the most rapidly evolving industries in the world, and every day brings new challenges, new innovations, and new ways to improve patient outcomes and organizational performance. Today we take a deep dive into some of the most important conversations happening right now in healthcare leadership, digital transformation, patient experience, and the future of medicine. We will journey through the voices of experts and the lessons being learned across hospitals, health systems, and research institutions, starting with the changes reshaping the healthcare workforce. Across the United States and globally, healthcare leaders are finding themselves at a critical crossroad. Staffing shortages, burnout, and retention challenges are pressing concerns. Hospitals are investing more in well-being programs, flexible scheduling, and innovative ways to support frontline caregivers. The conversation is not just about numbers, it is about culture, purpose, and creating environments where nurses, physicians, and staff feel valued, respected, and able to provide their best care. In many organizations, this includes expanding telehealth and hybrid care models to reduce the strain on physical spaces while still providing timely access to care. Digital health has become a cornerstone of transformation. Artificial intelligence, data analytics, and predictive modeling are revolutionizing the way hospitals operate. Imagine an emergency department that can forecast patient surges, a radiology department that uses AI to detect anomalies earlier than ever, or a care team that receives real-time alerts about patient risks before complications occur. These tools are not about replacing humans, but about empowering them to work smarter and with greater precision. And as technology advances, so too does the responsibility to safeguard patient data and privacy. Cybersecurity remains a top priority for every health leader. In the last year alone, cyberattacks have cost hospitals millions of dollars and disrupted critical care services. Organizations are investing heavily in training, new infrastructure, and partnerships to build resilience against these threats. But beyond technology, there is the human story of patients and families. Patient experience is no longer an afterthought. It is central to strategic planning. Health systems are looking at every touchpoint, from scheduling to discharge, to ensure care feels compassionate, seamless, and personal. Leaders emphasize that the patient voice is not just feedback, it is guidance for shaping the future. And one of the biggest shifts is the focus on behavioral health. Mental health challenges, addiction, and community-based care are becoming integrated into mainstream healthcare delivery. Many systems are expanding access through telepsychiatry, crisis centers, and partnerships with schools and local organizations. The stigma around mental health is being challenged daily, and leaders are committing resources to meet patients where they are. Innovation is also visible in specialty care. From oncology to cardiology, precision medicine is unlocking new pathways. Genomic data allows doctors to customize treatments in ways that were unimaginable a decade ago. Cancer patients are benefiting from targeted therapies, while heart patients are monitored with wearable devices that detect subtle changes before a crisis occurs. All of this points to a new era of proactive, personalized care. And while science pushes forward, leaders emphasize the need to maintain humanity in healthcare. Empathy, listening, and presence are irreplaceable values. As one CEO recently shared, technology is the tool but compassion is the cure. Healthcare economics are another central theme. The rising cost of care is a concern for patients, providers, and policymakers alike. Inflation, supply chain challenges, and labor costs are forcing hospitals to rethink operations. Many are pursuing value-based care models that reward quality over quantity. Others are exploring partnerships across industries to share resources and expertise. The question remains, how can health systems remain financially sustainable while still expanding access and quality? Another area of discussion is the role of private equity and partnerships in healthcare. Some leaders welcome the investment, pointing to opportunities for growth and innovation, while others caution about the risks of prioritizing profit over patients. It is a debate that will continue as healthcare organizations evolve. But what is clear is that leadership requires vision, courage, and collaboration. Leaders are not just managing hospitals, they are guiding communities through uncertainty, crisis, and hope. They are setting the tone for culture, strategy, and the future of care. In conversations with health system presidents, chief medical officers, and innovators, one theme repeats: resilience. The pandemic tested every corner of the healthcare system. And while the scars remain, so does the determination to build stronger, smarter, and more equitable systems. Diversity, equity, and inclusion are no longer optional. They are fundamental to creating trust and ensuring every patient receives the care they deserve. Leaders are embedding DEI into hiring, training, and patient care strategies. They know that representation and cultural competence directly impact outcomes. From rural hospitals to large urban centers, equity is a guiding principle. At the same time, the global perspective cannot be ignored. Healthcare challenges cross borders, from pandemic preparedness to climate change. Collaboration with international organizations and knowledge sharing are key. Innovations in one part of the world can inspire solutions elsewhere, and lessons from crises become blueprints for resilience. As we move deeper into this journey, consider the role of community partnerships. Healthcare is not just what happens inside the hospital walls. It extends into neighborhoods, schools, workplaces, and homes. Organizations are building bridges with community leaders, faith groups, and nonprofits to create holistic support systems. Food insecurity, housing, and education all connect back to health outcomes. Addressing social determinants of health is becoming central to strategy. Leaders know that true wellness requires more than clinical care. It requires community care, and in these conversations, a vision emerges: a healthcare system that is accessible, affordable, innovative, and above all compassionate. But the path forward requires commitment, collaboration, and courage. Every story shared by a leader, a physician, or a patient reminds us that progress is not just about numbers on a balance sheet. It is about lives touched, lives saved, and futures changed. Healthcare is not static, it is a living system, constantly adapting and evolving, guided by science, driven by compassion, and shaped by the voices of those it serves. This ongoing dialogue is what makes the journey both challenging and inspiring. And as we close today's exploration, let us remember that the work of building better healthcare never ends. It continues in boardrooms, at bedsides, in laboratories, and in every heart committed to healing. Together we move forward with hope, innovation, and the promise of healthier communities for generations to come. Thank you for staying with us on this journey, and please like, share, comment, and subscribe to our channel Health vs. Natural Bites. Thank you.